Another thing I want to bring out is anxiety. Like, most clients are anxious when they start therapy, especially if like it's their first time doing therapy. Like, that's normal. Like, it's normal for you to feel a little anxious. Um, Sometimes, not all the time, the therapist is a little, nervous too. Like, it ain't just you. Like, you're not by yourself in that. Sometimes. One of the things I like to do is I like to always, of course, introduce myself first and give them the opportunity to introduce themselves. Make sure you read that paperwork before you should read the paperwork before you start. But one of the things that I like to do to kind of like lower the anxiety in clients is like, first of all, I pick up on body cues. I can tell when you're fidgeting with something. I can tell when you're shaking. I can tell like by the way you speak, like if you're speaking too fast. Like, I could tell, basically. So I sometimes would just ask, like, are you a little anxious? Like, do you feel nervous? They're like, yeah, I feel nervous about the session. Like, I'm a little anxious. And in that instant, I do like some type of like breathing exercise or something to like calm them down, like grounding, empowerment therapy. Like, I use that tool a lot as far as like normalizing the feeling. A lot of times, again, I think I present with like a friendly, I guess, style where a lot of people feel like, not like I'm their friend, but they feel like I can open up to her. Like, I have clients that be like, dang, I ain't never tell any of my therapists this. I don't know why I'm telling you this. I don't know why you're telling me it either, but we need to talk about this and we need to work on that because that is the issue that you just brought up. So how can we, it don't feel good. It's not comfortable, but it's something that we need to work on. I also know, like, I'm not for everybody either. Like, I will validate you. I will agree with you on things that I agree with. But there are times when I'll either call you out on your stuff or, like, I will, like, question it. And not to, what's what I want to use? Not to, like, be offensive or be confrontational, but more of, like, to help you see how your childhood or a certain situation or like, it's usually life experience. So life experience, how it is still creating the narratives in the way that you operate in life, and some of the thoughts like that you have. Like, a lot of times we have these thoughts that have been formed based off our past experiences that we don't really notice. Okay, so this concealer, I usually use Born This Way, but lately I've been using Haus Labs. And I like the concealer better than their foundation. Like, their foundation I'm not a fan of. I feel like it dries out my skin. But the concealer, I like it. So that's about anxiety. I also want to point out that therapy is not about being perfect. Like, you don't have to show up and be perfect. You don't have to show up and tell a perfect story. You don't have to pretend like life is good and like all is well and like, oh, I'm doing so good, I'm learning and da da da, I'm healing. It's, especially when you're a Christian, it's like the Bible, how it talks about, like, you can tell certain things, or you can tell if you are a child of God by the way, like, you're, like, how you bear your fruit. Like, talking about the fruit of the Spirit in that situation. But in therapy, like, healing, and you don't really have to announce that. Like, most therapists can tell based off of your fruit, based off how you operate, based off of, like, the different things that you're doing. Like, we can tell. We don't really need you to tell us, because then it seems performative. And when you get back in, or if you start to get depressed again or anxious again, or it shows back up, you're like, I don't know and I don't know how to heal this. It keeps coming back up. It's like if you're not honest with where you stand at, then it's hard for the therapist to kind of follow you. So like you want to show up a little bit like, and I guess that's what makes therapy hard too, because sometimes you really don't know, and that's the real thing. Like sometimes you really don't know how you're feeling. Like you don't know that you're sometimes, especially anxiety. Anxiety will sneak up on a girl, okay, or on a male. It will sneak up on you. Being licensed in like 5 states though, it's funny because I noticed like you be like people. I notice how people are different geographically too. I mean, it is a certain demographic that I see as well, but like you can tell. Sometimes I feel like you can tell um, where certain clients live at based off of like their thought process with therapy sometimes, and it's like, is this sustainable? Because we have to create like some realistic goals, and if you're not being honest, like, is it sustainable? I do like one thing I do like is the clients that are like patient a little bit, because like one thing with therapists, like they should be culturally um they should be like culturally competent. And so I have clients that are, you know, other races and stuff like that, of course. But one of the things that I do like is they don't mind like sharing, like teaching, like therapy. The therapist is still learning as well, because like I could think I know everything about, let's say, Nigerian culture or Filipino culture or Chinese culture. I could say I know, you know, I done the study, I done the work, I research, I work with tons of people within that race group, and still I still learn so much. Now what I will say is a lot of the minority ethnicities, they kind of mirror, like their thought process kind of mirror sometimes like African American homes, but of course they have different culture, like they have different things they do and stuff like that. So, you know, I'm constantly like reading up and researching, because you want to be as culturally competent as possible, so that you can, again, you're there to service the clients, you're there to help the clients. So in 2026, that is, if you are of a different ethnicity, that is something you want to look into too. Like, are they culturally competent? Because if not, they'll diagnose you with things that is normal in your, like in your race group or in your ethnicity, in your nationality, because they don't understand that's how y'all are. Like, so you want to be mindful of that. But I love it. I love when they like teach me. I'm like, oh, I did not know that. Okay. Because I think culturally competent is a thing that I don't think nobody can be like 100%. I know everything about another culture. Like, I think it's a constant learning curve. Because I don't think any culture is monolithic. And so, just like African Americans, people be like, oh, African Americans go do this, or they do this, or they do that. Again, it's not a monolithic, so it's like not quite. Like, you can't put us all in one box, basically.